Assalamu alaikum dear student. This is the third part of the hypertrophy topic general pathology playlist, and this is the MCQs on the hypertrophy. So there is different MCQs. First MCQ, I will tell you that the first MCQ, a 53-year-old woman with no past history of illness, means there is no any other illness, and the physical examination, her blood pressure is 150 by 95 millimeter of mercury. Then this is the main point, that her blood pressure is 150, mean it is a hypertensive woman. So if it is a hypertensive woman, if it untreated for years, if she do not take any drug to maintain his hypertension, then which cellular adaptation see in the myocardium? Myocardium is the middle layer of the heart. What are the options? Apoptosis, fatty change, hemosiderosis, and the hypertrophy. So you know that a 53-year-old woman and he has a hypertension, if she do not take any drug to maintain her hypertension, then what will be the prognosis? This answer is the hypertrophy. Hypertrophy is the main, because there is, I tell you that in the previous video, the main stress is hypertension or the valve defect. So there is hypertension, a hypertensive woman, and if do not take any drug, then hypertrophy of the myocardium will be done. The second MCQ is the 71-year-old man has difficulty in the urination for the past 5 years with hesitancy also. The transurethral resection of the prostate show microscopic nodules of glands. Which of the following pathological process which likely in the prostate? So there is a 71-year-old man, he has difficulty in the urination and hesitancy. What do you mean by the hesitancy? Hesitancy is that if a person want to urinate or maturation, but he want to maturate on that time, but the urine not come on that time. So when we take the transurethral resection of the prostate, mean we take a small tissue in the prostate, and the macroscopic examination show nodules of glands. Then what is the pathological process which likely in the prostate? The options are the hyperplasia, hypertrophy, apoptosis, and the metaplasia. Remember that this option, the right one is the hyperplasia. But I want to tell you that there are two terms for the disease: prostate, benign prostate hypertrophy, and the benign prostate hyperplasia. Both are used interchangeably. So there is any here benign prostate hyperplasia or hypertrophy, they are the same, but this condition only occur in the hyperplasic patient. So in my past video, I tell you that the benign prostate hyperplasia, benign prostate hypertrophy is a type of hypertrophy, but is not a hypertrophy, it is a hyperplasia. So please correct that point, and this is the right option, hyperplasia. The third MCQ is the cardiac hypertrophy. Is in the cardiac hypertrophy, if the patient has a cardiac hypertrophy, there is a reinduction of genes which increase natriuresis and sodium and decrease the sodium reabsorption. So what is the protein which encoded by these genes which decrease the sodium reabsorption and increase natriuresis, but they only occur when cardiac tissue is under stress or they are hypertrophied? So arterial natriuretic peptide, venous natriuretic peptide, aldosterone, and the atrial natriuretic peptide. So the right answer is the arterial natriuretic peptide, or the ANP. It is also called the atrial natriuretic factor. So there is a patient of the cardiac hypertrophy. So when there is a hypertrophy, mean there is any stress on the heart. The stress on the heart induce genes for the ANF or ANP, atrial natriuretic peptide or factor. So this is the right answer. The fourth MCQ is the which of the following stimuli work to increase muscle protein synthesis and hypertrophy of heart? So means that which of the one of the stimuli increase the muscle protein which cause the hypertrophy of the heart? So there is a mechanical stress growth factors, which is the insulin like growth factor 1, and the TGF beta, and other is the alpha adrenergic agonist, and the fourth option is the all of these. So this is all of these. because mechanical stimuli, it is a stress and the growth factor, which I tell you in my second video, it also play a role, and the alpha adrenergic agonist also play a role in increase in the protein synthesis, and the hypertrophy of the heart also occur. The fifth and the last one is the hypertrophy refers to cell death, cell size increase, and the cell number increase, or all of these. Hypertrophy refer to increase in cell size. So this is the right option. These are the very important MCQ. Student, please subscribe and like our channel of MLT DEC0DE.